Hello, everybody. Good morning. Welcome to this session, one of the last sessions of this incredible annual meeting of the EASD. And let me see. Okay, and what I would like to do is just to introduce to you what is one of the most recent action of the European Diabetes Forum. Now, I'm Stefano Del Prato. I'm the current president of the EUDF, but I'm actually not the president, but simply the spokesperson. And I'm speaking on behalf of a number of associations that are all united within the EUDF. You can see here is the ISPA, JDRF, EASD, EFSD, FEND, International Diabetes Federation, the Société Francophone du Diabète, the PCDE, together with EFIA and MedTech Europe. Why so many organizations all together? For a very simple reason, because we want to have an harmonized voice to really convey messages that can be very important for people with diabetes, particularly nowadays, because in the next few months we will be running into the election time for the new European Parliament. And I think it's important for all the stakeholders working in the field of diabetes to get together, as we have done, and we got together to try to identify needs for people with diabetes in a united voice. One of the concepts that is behind our request or our alert toward the potential candidates for the election of the new European Parliament is the need for the 30+ million of people with diabetes in Europe to be able to continue contributing to the growth of the society. We would like to have people with diabetes to be active person, working, living a normal life, contributing to the society, really being part of the society and to be peers to all the other people in Europe. I don't need to tell you, but we need to tell maybe politicians or who's are going to represent us in the European Parliament what is the situation of diabetes. How many people still die for diabetes or related condition. Also, we needed to let them know that working on diabetes can be a very effective system to save money, or if you wanted to use money for other purposes. Now, 75% of the money that are spent for diabetes is because of complication, is because of hospitalization. And we think that we have now better ways to try to reduce this burden, and because of that also to reduce the expense associated to diabetes. As I mentioned, in Europe, we have more than 30 people with diabetes. I'm not going to spend a word on this slide because I'm speaking to experts in diabetes, but this is the information that we are conveying to people that are going to run into the election. What is diabetes? Which forms of diabetes are out there? These are the three main forms of diabetes, but there are many other forms of diabetes that we should be aware of. And also, what could be the potential consequences of diabetes? And just again, trying to alert them that it's possible to really work now to really reduce this burden. And what we have done within the EUDF is to have all the stakeholders to come together and asking ourselves, what are the priorities? And it's not the priority of the organization A or D or Z. This is the priorities of the diabetes community as represented by all the stakeholders working in the EUDF. So it is my great pleasure to introduce to you Dr. Niti Pal. She's past president of EUDF Europe, but that's not only. She's a very active, energetic person that has spent almost her entire life for the cause of diabetes. Niti, the floor is yours.
Thank you, Stefano. And as usual, thank you very much for that very warm introduction. So hello, I see lots of friends in there. Oh, hi, Elena. Hi, Ramas. Oh, hello. I've seen lots of friends from Europe and across the region here. Thank you very much for coming to this very, very important European pledge. And we at IDF Europe, as Stefano has said, have been working really hard, and I haven't got my clicker with me. I walked off without it, so I'm going to get it back. Thank you so much. I've been working together very, very collaboratively in EUDF to actually get some of this. And thank you, Bart, who's going to speak a little later, on actually hosting the Secretariat and getting it to where we are. And I have 3 friends at the back who've been, Sabine, thank you for everything you've done to actually get this up and going. So what are we saying? I think, as Stefano said, this is a really important pledge. It's the first time we're getting a pledge. We are, of course, with IDF Europe, we have had the parliamentarians, we have a parliamentary group that's been actually doing this for some time, so it's led to some wonderful work at EUDF on this. So what are we saying? We're looking, and this is the pledge. If anybody wants one, this is what we're asking for. Please take some back. If there are any member associations here from IDF Europe, please take them back to your home countries, because this is something that we're going to be promoting as we go along. And I'm afraid I can't hold that and talk at the same time. So what are we asking for? We're asking for early detection. This is ensuring timely diagnosis and alerting people at risk. And this is all people with diabetes. This is not type 2 or type 1 related. It's for everyone, gestational, everybody. The second bit is we're asking for equitable, high-quality care, which is providing the right treatment for the right person at the right time. Big words, huh? But in my time with IDF Europe and with our member associations, we found there was unequitable access to care, even in a region like Europe. In some countries, you get 1 strip. And Elena, I guess, you've been talking about this in Georgia for as long as I can remember, on how difficult it is to get even test strips for some patients. And in some countries, you've had pumps forever. So this is about equitable access to high quality care. We're not just talking about the affordability bit of it, which is very important for health systems. I do that for a living, but it's about high quality affordable care is what we're talking about here. The third bit is we've asked for is empowering people, which is for us, I guess, and for me personally, mine's a personal journey. I have my son in the room somewhere out there, Jay, we're a family that's lived with type 1 diabetes for over 30 years. So we understand what this means. I understand what it means. He understands more than me, I'm sure. But there are people with diabetes that want to help, but also need some help themselves. We need to empower them and not just say the words, not just talk about person-centered care, not just talk about putting the patient in the center of this, but with personalized care, you've got to really start at the beginning. So on policy, on research, on delivery of clinical care, the person with diabetes being the center of this and empowering them to make their own decisions. And I do remember a very good story. Javier, I hope you don't mind me sharing it. Javier was about 7, and he walked into the clinic with Jeremy Kirk. Some of you might, Bob, you might know him. Walked into the clinic, and he used to go from room to room with the diabetes educator, with the nurse, with the dietitian. And one fine day, he said, "I want you to wait outside, Mom. I don't want you to go inside." And he marched up to Jeremy Kirk, his consultant endocrinologist, and said, "Why do you all see me separately and ask me the same questions over and over again? Can't you all sit in the same room and ask me those questions that you need to and record what you need to do? And that'll save you time, and me, I want to go play hockey or swim or whatever it is I want to do that day." And thankfully, Jeremy actually listened to him. And the way the clinic was set up, the pediatric diabetes clinic, changed since then. So an empowered person with diabetes can change the way we deliver care, how we get outcomes, what kind of research we do. And then on the fourth bit that we're asking about is embracing science and technology. And who better to talk about this than someone like Stefano and some of my friends in the crowd here. Diabetes research needs to be prioritized. What we found is diabetes research in Europe is not being prioritized. What we found is that the big C takes precedence. And by the way, I'm a 2-cancer survivor, so I'm not dissing that, so I know what it means to have cancer. But the problem is just as big, and we haven't had the equitable research that we're asking for a pledge for the European Union to actually talk about this with parliamentarians. And the other thing is, obviously, these days it's not just about the pure science. It's very important, the pure science, but it's also about the tech, the data, and what we can do to harness that. So we're asking parliamentarians to embrace that, to fund it, and to make sure there's equitable access to science and technology across the region, particularly on diabetes care. So I've talked about most of this. I'm not going to go through it again. And I'll get to Bart in a minute. But before I finish, Bart, if I may, for 2 seconds, this has been, like I said, a very collaborative effort between the coalition partners of EUDF. And thank you, Stefano, for your leadership on that. It's been very collaborative, very good. We've all contributed a lot to this. And I asked the coalition partners, all of us here, PCDS, all the others, and everyone who's contributed to this, then when Bart talks about implementation, it ain't going to happen just on Europe. It's going to happen in country. And it's going to be really important that the in-country member associations, people like Elena and Ramas, who've been working forever in diabetes world, can take it to their country, take it to our member associations, right, Elizabeth and Sabine, and make sure some of these pledges that we're talking about are actually implemented in practice. Thank you so much. Over to you, Bart.
Thank you. So indeed, I have the very practical aspects of this work. And first of all, let me thank Niti for chairing this group. We literally started from scratch, having all our members around the table, having multiple workshops, and then refining this document to make sure that we are all aligned and heavily supporting what we discuss here today. So, as Niti said, we need all of you, because I live in Brussels, I live in Belgium, but as you all know, it's not in Belgium that your members of European Parliament, for instance, are elected. It's in all of your countries. And so today I will have some practical tools that we will make available for you to make your life in a way easier and to make sure that you also have at your level, in your country, in your region, discussion with the politicians or at least the candidates who will represent you and your country in Brussels and other institutes. So again, this is very practical. You have seen the document as it is. We made it ready for this week, but I can tell you that also translations are underway. So we will have this pledge translated in German, in Spanish, in Italian, in Romanian, in Dutch. I might forget some countries, but let's say the main languages. And by the way, if you don't see your language here and you would like to have it in your own language, talk to us, talk to the members, they are here around, and we can make it available. So that's something very practical, because I have many meetings in Brussels, very often together with the IDF Europe team, and we see the value of being able to talk in your home language. So please let us know what we can do for that. We will make it even more easier with some talking points, with some facts and figures per country. I know also there are country sheets available, there are pictures and that summarize the situation in most of the European countries. So we really want to talk with politicians in their own language and with some facts and figures that speak to themselves and that talk about the incidence, for instance, of diabetes in their home country. Again, I will not go in all of the details, but you will see a campaign that basically we kicked off today with, for the first time, going out to all of you, because again, I think that if there is one message you certainly need to capture today, is that we really count on you, because at the end of the day, this is work we did for all of you. And as you're here at the EASD conference, and you will be present at many other conferences in the future, we really take the opportunity to involve you, and hopefully you engage with us and our members on this effort. So we start today. The elections are on June 6th until June 9th, so there is a bit of time. This is a marathon, so we can do many activities, and once again, if you have any ideas, come and talk to us. I will not go a lot in detail on this, but we will do, of course, some activities at European level and at national level. We will involve all our board members, all our members, and again, as Niti said, we are also very much looking at the patient associations, professional associations at country level, and we met a lot of them also here in Hamburg over the past few days. And so last but not least, and I will end here, also at national level on our side, we see opportunities to work, but if you have a local conference, Again, try to involve politicians. I think that's also what we try to do here in Hamburg, and we try to do at other conferences as well. I think the fact that we have now a multidisciplinary approach, and I welcome also here at the conference that we have by default now people with diabetes in the rooms, people with diabetes having their own sessions. I think the next step is that we certainly also bring in the politicians to the conferences. So once again, I will thank in a way all our members who contributed. So you see the contact details also at the end of this pledge. The pledge is now available on our website. We hope our members will also post it on their website, and as I told you, I hope within the next couple of weeks, at least 2 weeks, it will be available in all of these languages I mentioned before on our website. And the same for the companies. You see, we are an inclusive organization. Also, the companies contributed to this work, and also we count on them at the country level to facilitate some of these activities. So basically, top line is, this is also your work. I'm looking to all our members, to the supporting collaborators. You own this work. This is for you, and please use it as much as possible. So here you see the contact persons. Again, this is all on our website, so I don't, you can probably read it, but just to show, this is a how can you say, a total community effort, so you can whether contact me or any of the contributors of this work. So I think we have some time for questions. I don't know if somebody in the room wants to comment or has an idea. Feel free to come to me, Stefano, Niti.
Thank you very much, Bart. If there is any comment, suggestion from the floor, we're more than happy to get them. But
I think there may be, oh, there's somebody there.
okay, good.
I'm supposed. You, Udo.
We're making you stand up and exercise first thing in the morning.
Udo is from Germany.
Good morning. My name is Udo Schauder, and I have a question about, I know it is a problem for single indications in my country, in Germany, to have the politician access. It's better to combine more indications, like under the roof, for example, cardiovascular diseases at all, and then they are willing to do something. But for a single indication, there is no chance in Germany.
Thank you for that comment. Shall I take that, Stefano?
Yes,
Yeah, and
please.
then, yeah. So we at IDF Europe, have been debating this forever. Sorry, what was your name again?
Udo. Udo.
I'm sorry, I didn't.
Udo.
Udo. Got it. Udo, we've been debating this forever about, whether we should go, and we do collaborate very, very hard. Stefano is the prime example of this. He collaborates with most people I know, and he's been collaborating on the cardiovascular side forever. So we do go with our partners and stakeholders on cardiovascular disease when governments are looking at, and we bring the diabetes voice in. But we found that the diabetes voice was being diluted across Europe, and particularly around tech and innovation and equitable access. And during COVID, we found what happened. People with diabetes were adversely affected to a large extent, not in terms of just COVID, but other things that they didn't manage to access. And suddenly, WHO Europe, all the parliamentarians woke up, and we've got a WHO compact that's come out this year for diabetes. So it really depends on your life cycle, on how you advocate for diabetes at which time, but your point is well taken. Stefano, I don't know what you want to say.
No, I just want to say, first of all, that within the EUDF, we are very well aware of the role and importance of cardiovascular disease, to the point that we had an event at the European Parliament for cardiovascular disease and diabetes, trying to convey this kind of message. However, I agree with Neil that it's important really to come up with a voice for diabetes. And I would avoid starting off in a negative way and say, if we don't do this, we will never get there, all right? We need to be very aware of what could be the potential barriers, but I think that we need to really push along. And I think it's important to really raise the question of diabetes. And there is another issue associated with diabetes, which I think it's important to bring up. You know, I'm sometimes get the impression that diabetes becomes a disease only when you got into the complications. So when you have heart attack, when you have myocardial infarction. I think, you know, fostering the concept that diabetes is a condition where much can be done in order to prevent exactly that complication is a concept that we need to really get more people to be aligned with. Otherwise, we'll push, you know, all the intervention on diabetes on the late stage when much less can be done, to my eyes. We need to really foster and to really bring the attention on the importance of prevention, which is prevention of diabetes, also prevention of the complication.
I think you have a follow-up comment, right?
So don't get me wrong. I know the WHO in every session announced cardiovascular death is #1 of deaths in the world. And the main driver for cardiovascular death is diabetes and obesity. So I think under this roof, we had a great chance to get more voice in every country.
Yeah, and I think you're entirely right, Udo. I work a lot in my other life, my professional life. I am a doctor, but I do very little of that now. I work a lot with insurance companies. I work with massive insurers across about 8 or 9 jurisdictions at the moment, including Europe. And the insurer, the payer, has understood this. So if politicians haven't, the payers that are paying for some of this care have understood it. And in fact, in about 5 countries currently, I'm working on diabetes services, prevention, better control, digital services bundled with insurance. For the first time, I'm seeing in the last 2 years that shift has happened. So I think we're starting to get there, but it's not entirely there yet.
Another question?
Hi, I'm Jane Spate. I'm from the Australian Centre for Behavioural Research in Diabetes. I've been part of a panel that's developing an international consensus to end diabetes stigma. And I think that stigma and discrimination are a big part of the problem that we're talking about here today and why diabetes isn't getting the attention that it deserves. So I can't comment specifically on Germany. I know nothing about what's going on in Germany around priorities. But I did write a commentary that was published in Diabetic Medicine a couple of months ago about what was going on in Australia and the UK with some parliamentary inquiries and consultations. In Australia, there was an inquiry. It's the first time in a decade or more that there's been a decent inquiry into diabetes. Initially, it got subsumed into diabetes and obesity, as though these two are just so hand in hand, we shouldn't do one without the other. I think that's entirely inappropriate and telling the whole community that diabetes is brought on by obesity, and that's not true for many people. This is not something that's a useful message for the wider population to hear. In the UK, they had a consultation about long-term conditions, very, very broad. In their press release, they put an example in there about how diabetes and depression shared some commonalities and how these commonalities are important, and yet their survey actually didn't refer to diabetes at all. And the version that they produced that was in plain language for people, in a simpler form of language, also didn't include diabetes until the 16th example of 16 conditions. So I think we have a major problem where diabetes is sort of up there, and then it just gets suppressed because actually I think the politicians and the wider community think that this is a condition that people bring on themselves and governments don't need to take responsibility for it. And I think that's the problem that we need to be sorting out.
Yeah, I totally agree with you, and which is why we, in the pledge, that's what we're talking about, reducing stigmatization is one of the big things that we talk about in empowering the person with diabetes. And there's nothing more, and I was with Diabetes UK for years, the politicians, if their citizen, their constituency actually eyeballs them with this. There's nothing more powerful than that, and which is what our member associations are very powerful at doing. So totally take on board.
Yeah.
Entirely correct.
Absolutely. And I know Chantal told everyone on Tuesday that the EASD has taken the pledge to end diabetes stigma, but I encourage everyone here to go on enddiabetesstigma.org. Take the pledge as an individual, take the pledge as an organisation if you represent an organisation, and spread that word.
Thank you.
And then along that line, really I'd like to highlight what is the point that we put in the pledge, is that we want people with diabetes to contribute, to be normal citizens within the society. I mean, I think that's important to really look at the problem of diabetes, not just, as a negative impact of that, but of how much we are losing not having people with diabetes to be active citizens within the activity of the society.
Yeah,
and I think this is one way maybe that can help also to change the
Thank
stigma.
you.
Yeah, thank you.
Bob Ryder from Birmingham in the United Kingdom. Very sadly, there was a Brexit, and so we aren't part of the European Economic Community anymore. But nevertheless, there's going
We
to
can
be...
still use it, though.
there's a general election in the UK next year. So is there anything happening in the UK along the same lines?
So Bob, I mean, this is, while this is a European Union going for the parliamentarians, and this is where this goes, but like I said, this goes out to our member associations in IDF Europe. And yes, sadly, we did Brexit, so I'm the laughing stock of everybody sometimes when I'm standing in queues, long queues. But absolutely, this is for member associations, as I said, and Bart and others will be making this available to other, and we will, in IDF Europe, be making this available, and Diabetes UK is a member. So it will go across to everybody to be able to use some of this with their own parliamentarians as well.
And Bob, remember that this was really a concerted action. So all the associations within the EUDF have contributed, and some of these associations have a lot of a strong root in UK. So please, if you agree with what the EUDF and the entire consortium within the EUDF has come up with, you think it makes sense, use that for your UK election. It is the pledge made for the election, but I like to look at that as made for Europe. And for me, Europe is not just the European community, as it's a political entity.
Thanks, Stefano. That's very generous of you. Thank you.
No, it's not generosity. It's that, we care for people with diabetes, and they don't have a nation color on the jacket.
I'm Ramaz Kurashvili, Diabetes Center of Georgia. Very warm greetings, dear friends. We need now support from the European Parliament in field of oncology, because the patient with diabetes, they have a discrimination in this clinic. I met several times our dear colleagues, oncologists, have a very hot questions. The million patients, with diabetes in oncology clinic don't have any high quality support in oncology, because they said, we don't have any time for diabetes. That's why we need to support our patients, people with diabetes in oncology clinic, and stop, general discrimination of patients. Thank you very much.
Thanks, Ramaz. And as usual, you and Elena have done sterling work, your amazing work that you're doing in your own country. But I think you raise a very important issue around stigma that is also related to other conditions. And, you end up with diabetes, and I used to find this a lot, Stefano, when I did proper general practice with Bob. When I went into people's homes and I went into nursing homes, elderly folks, that stigma of diabetes translated, this person has diabetes, that's why they're falling, or this is why they're not too great. And so it still exists. It's a little better than it used to be, but very vulnerable patients, wherever they are, that stigma is even more. So I think we need to be careful. Very important point you raise. Thank you.
Thank you.
Neeti, can I just ask a question?
Oh, there's someone here. Another person I know.
Hi, Neeti. Naresh Kanumulia, GP in the Republic of Mancunia, right? So
It is a republic, Naresh.
we're an independent country already. So my question is, one of the things we looked at was employment charters, a good employment charter, because increasing level of diabetes within people of jobs, you know, within employment. And the problem with them is trying to get to annual reviews and things like that. And unless we have some form of mandate, let's say, that allows employees to take time to go and attend you know, the appointments in the hospital and things like that, we're going to struggle with that because the diabetes is getting more and more pronounced in people of job seekers. Any thoughts on that within Europe at all? Or?
I mean, we haven't gone down to the specific details of action. Of course, as you can imagine, being in all the time of the election for a new parliament, we want to have their diabetes in their agenda. And then once we have enough people, you know, that may be supporting that, we can go down for specific lines as you've been suggesting. But I think that's, again, fits with what I was trying to convey before. We want people to really be active within the society, and there are a number of barriers. I do remember, for instance, there is a movement at European level for people with diabetes being allowed to fly and to be, okay? So there is a number of issues, a number of positions, number of jobs that still are limited by the condition of diabetes. And we have much improved over the time in the way we can provide people with diabetes a better way to manage their disease and to make it safer with respect to whatever is their job. So this is things that we need to bring up in the agenda, but right now we need to have sufficient people, you know, that are aware of what is diabetes and how much can be done in order to help people with the diabetes. And not just because people with diabetes are a specific segment of society, because we want them to be, as I said before, and allow me to repeat, active part of the society.
I can maybe add to that there is a European project that will start just in a few weeks from here. And one of the work packages, one of the 6 content work packages will be on labor participation. So probably that's something to look at. 21 countries will join. Again, focused very much on the EU, but that is one of the work package. I don't have more details, but I know it's an important topic and included there.
It's a very important point, Naresh. So I've registered it. It's a good way to get action. As I said, I work a lot with insurers across the world. And in low and middle income countries, particularly with blue collar workers, we are finding this is a very good way to get diabetes awareness, particularly with, you know, we demonstrated to one company I was working with in Indonesia, we found that 43% of their workforce would be either dead or have severe complications if they weren't screened properly. And that kind of woke them up a bit.
And with that, Niti, we have come to the end of this session, but I think, you know, I'm really very much appreciated all the contribution and particularly what is the interest. I think that we are here, you know, to work in diabetes to improve the life of people with the diabetes. Thank you very much, Niti. Thank you for fantastic collaboration. Thank you for fantastic collaboration to all the members of the EUDF, and thank you, Bart, being a great chief officer for the association. Thank you.
Thank you.